Adult Day Services programs often assist families with balancing their work and caregiving responsibilities. We learned how by visiting the Humboldt Senior Resource Center. We'll show you here and now on Redwood Newsmakers. Wendy Starr is the Director of Adult Day Health and Alzheimer's Services at Humboldt Senior Resource Center here in Fortuna. Welcome, Wendy.
Thank you, Ross. I'm glad to be here.
Hey, can you tell us a little bit about what an Adult Day Health program is?
Sure. Adult Day Health is a program for folks who have medical or behavioral health needs, disabilities, if you will, aged 18 and above, who would benefit from a social and medical program to help them monitor their healthcare needs during the day and enjoy some good food and good fun at the day center.
Well, what might be a typical day for a participant in the program?
A typical day for folks who come into the day center, they are provided transportation directly from their home to the day center. When they come in, they are greeted by our friendly staff. They're given a beverage, usually hot coffee. We have really good coffee. And they are immediately introduced to the day's activities. It can be arts and crafts. There will be a lecture. Sometimes there's even a field trip. And then they're provided with a meal here in the beautiful day center. And then continue on activities in the afternoon, and then they're picked up by our transportationists and brought back to their homes.
Well, who is most likely to attend an Adult Day Health program?
Sure. So Adult Day Health is available for folks age 18 and above with disabilities or behavioral health needs. The typical Adult Day participant is going to be an older adult, someone who perhaps would benefit from being around people during the day, having some fun activities, and having some medical oversight. We have registered nurses in each center throughout the whole program day, and that can be an extra layer of support for people when they have healthcare needs.
What are participants and their families looking at for the cost of a program like this?
Sure, and that's a good question. So our program is covered by Partnership Health. So most of the participants who come into the day center, their fees are covered by Partnership Health Plan. But we also have contracts with the VA, so our veterans can be served by this center. And then we have a contract also with regional centers, so folks who are served by that organization have their fees covered by regional center.
There are two locations in Humboldt County.
Yes.
Tell me about those.
Well, we're here in our beautiful Fortuna location, which is the newest space that we've created for Adult Day Health. And in the Fortuna location, we partner with Redwood Coast PACE, and we share a day center. It's a very lively and beautiful space, and we're all very proud of it. In Eureka, we have our facility at 1910 California Street, which is the classic Senior Resource Center location that's been around for years that everyone has come to know.
Can you explain how this would provide respite for families for services like this?
Yes, and that's a really good point to bring up, Ross, is that when folks come into the day center, they are provided supervision and care. This is a licensed facility, and so when folks send their family members to our locations, they're taken very good care of by our staff, and that allows family members to be able to tend to the things that they need to for their homes, have a bit of a break, get some errands done, do other things that they need to, that they can't necessarily do when they're providing care for someone at home who has healthcare needs.
Wendy, what's the best way for someone to enroll in the program? And are there tours available?
Yes, Ross, there are tours available, and the best thing to do is to call us at the Humboldt Senior Resource Center at 707-443-9747, or you can get more information on our website.
Wendy Starr from the Adult Day Health program here at Humboldt Senior Resource Center, Fortuna. Thanks for inviting us.
Thank you, Ross.